Okay, now we are now going to, so we have seen the risk factors. So according to the SchrDbb algorithm, so this is the algorithm now. So we have taken the first part, which was the risk factors and the background here. Is it clear? Now we are going to visualize the mechanism and the pathogenesis. Is it clear? You visualize the mechanism and the pathogenesis. Now you need to know that you need to know that there are two major strokes. So we have stroke here, and this stroke is coming from two different things. It can either be ischemic or it can be hemorrhagic. So those are the different two parts where you have stroke. It can be ischemic or it can be hemorrhagic. Is it clear? Now the ischemic stroke has three major mechanisms. The first mechanism is atherosclerotic, the second mechanism is cardioembolic, and the third mechanism is lacrimal infarct. Is it clear? Why hemorrhagic stroke is mostly intracranial bleeding. Is it clear? So intracranial bleeding can be of any source, but the most important thing is that there must be intracranial bleeding. Is it clear? So those are the different elements that you're going to visualize. Now let's visualize this better. Now let's start with ischemic. Is it clear? When you have an ischemic stroke, so let's start with ischemic. When you have an ischemic stroke, you need to visualize that it can be of it can be of atherosclerotic origin. Is it clear? So let me explain. Generally, you need to know that what ischemic stroke coming from atherosclerosis is involved at the level of the carotids. Is coming from the carotid. Generally, an ischemic stroke which is atherosclerotic is because of a plaque disruption, dislodgement, and then further occlusion. It means that the plaque, when you have an atherosclerotic mechanism of ischemic stroke, it means that the plaque of an artery has dislodged and then it had occluded a distant blood vessel. Is it clear? And usually that plaque is coming from the carotid arteries. Is it clear? Usually that plaque is coming from the carotid arteries. Is it clear? Now, how can you visualize now this mechanism based on your physical examination? So we are finished on the history. You need to know now on your physical examination, what are you going to say? Is it clear? Since atherosclerotic plaque usually come from the carotid, it means that on physical examination you have an element that you can bring out. Is it clear? And that physical examination element is brute. Is it clear? You have brutes that you are going to hear at the level of the carotid. You are going to auscultate at the level of the carotid, and you hear sounds like shh, 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 shh. And those sounds are related with the pulses. Is it clear? During the systole, you are going to hear shh, shh. These are only during systole, and during diastole you don't hear anything. So those are brutes. When you hear these brutes at the level of the carotid, it can be the reason why the patient had a dislodgement of the atherosclerosis and then a further occlusion resulting to stroke. Is it clear? So that's the first element that you have to visualize for atherosclerosis. The element of physical examination is that you're going to have brutes. Now, the next element now is going to be for cardioembolic. Is it clear? For cardioembolic. So what happens when you have a cardioembolic stroke? Is it clear? Patients that have cardioembolic stroke, you need to visualize that one. The cardioembolic is coming from the heart. Is it clear? Since it's coming from the heart, or it can also come from the legs via the deep venous thrombosis, provided that the patient has a heart defect. Because normally, when the blood come back at the level of the heart, it has to be pumped up to the lungs. Is it clear? So if there is a deep venous thrombosis and then the clot has dislodged, come at the level of the heart, it's going to occlude instead the pulmonary artery, and the pulmonary artery has capillaries such that the clot cannot pass through those capillaries and come back to the general systematic circulation. Is it clear? So deep venous thrombosis is mostly related only with pulmonary embolism. But when you have a patient that has deep venous thrombosis and has a stroke, due to cardioembolic origin, it mostly arises from an abnormality of the heart, a defect of the heart, particularly atrial septal defect, ventricular septal defect, or you have a patent ductus arteriosus. So that is the first element. Now at the level of the heart also, you can have arrhythmias. Is it clear? Arrhythmias can make you think of a natural fibrillation. At the level of the heart, you can hear on physical examination, you have irregular rhythms, or regularly irregular rhythms may make you think of arrhythmias, particularly atrial fibrillation. Still at the level of the heart, you have elements like in valvular heart disease. So when you have valvular heart disease, you can hear murmurs at different auscultative areas. Is it clear? You can hear murmurs. Still at the level of the heart, you can have an ischemic heart disease where the patient may present with a history of excruciating chest pain. The patient may present with a history of excruciating chest pain, and then later on he has a stroke. So here you can think of a thromboembolization, which is a complication of the ischemic heart disease or the coronary artery disease. Is it clear? Now, the next element is that you may have a patient who has a history of heart failure, or you may see signs and symptoms of heart failure and then having a stroke. From here, you can think of a cardioembolic origin. Is it clear? If you have a patient that has signs and symptoms of heart failure and then has a stroke, you can think that the stroke is from cardioembolic origin. Is it clear? So those are the different elements that you have to bring out on the physical examination. Is it clear? So when you are involved with these patients, you must also see this part, which is the mechanism. Now the next thing is for hemorrhagic stroke. In hemorrhagic stroke, you need to know that there is intracranial bleeding. Is it clear? So there is intracranial bleeding. Now, those are so intracranial bleeding is the next method. So there is no particularity for you to know if the patient has an ischemic stroke from an aneurysm. You need to know that when you have an aneurysm, you may just look for other risk factors like kidney, because aneurysm may be associated with polycystic kidney disease. So you may examine at the level of the kidneys on physical examination. You examine at the level of the kidneys in order to visualize if the kidneys are enlarged on both sides. Is it clear? You can examine at the level of the liver to find if the liver is enlarged, because polycystic kidney disease is also associated with an enlargement of the liver. And then on your past history, you have a family history of a stroke in somebody else. Is it clear? Which occur in the young age. It may make you think also of that. So from here we are finished with the next one, which was the mechanism of the disease. Thank you.